Question 1. A nurse is caring for a client with heart failure who is prescribed furosemide, Lasix. Which electrolyte imbalance should the nurse monitor for most closely? A. Hyperkalemia. B. Hyponatremia. C. Hypokalemia. D. Hypercalcemia. Answer: C. Hypokalemia. This question tests your understanding of diuretic side effects, specifically furosemide. Furosemide is a loop diuretic, and the keyword loop diuretic should immediately make you think about potassium loss, as these medications work by inhibiting sodium and chloride reabsorption in the loop of Henle, which leads to increased excretion of potassium. Therefore, the nurse must closely monitor for hypokalemia, which is a dangerously low level of potassium in the blood. For instance, a client on furosemide might experience muscle weakness or irregular heart rhythms if their potassium drops too low. Always remember that loop diuretics like furosemide lose potassium from the body. Question 2. The nurse is assessing a 4-year-old child admitted with a high fever, sore throat, and difficulty swallowing. The child is drooling and appears anxious. What is the nurse's priority action? A. Obtain a throat culture. B. Administer an antipyretic. C. Notify the healthcare provider immediately. D. Prepare for intravenous fluid administration. Answer: C. Notify the healthcare provider immediately. This question is about prioritizing care for a child with potential epiglottitis, a life-threatening emergency. The keywords 4-year-old, high fever, sore throat, difficulty swallowing, drooling, and anxious are critical clues pointing to airway obstruction. The nurse's priority is to protect the child's airway, which means avoiding any actions that could further irritate or obstruct it, such as examining the throat or obtaining a culture. Notifying the healthcare provider immediately allows for rapid assessment and intervention, ensuring airway patency. For example, delaying communication could lead to complete airway closure. Always remember that maintaining a patent airway is the absolute priority in pediatric emergencies. Question 3. A client diagnosed with obsessive-compulsive disorder, OCD, spends several hours a day performing ritualistic hand washing. The nurse understands this behavior is primarily a defense mechanism to A. Gain attention from others. B. Avoid social interaction. C. Reduce anxiety. D. Manipulate family members. Answer: C. Reduce anxiety. This question focuses on understanding the underlying reason for compulsive behaviors in clients with OCD. The keyword ritualistic hand washing describes a common compulsion, and the core concept is that these behaviors are performed to manage overwhelming anxiety. Individuals with OCD experience intense anxiety from their obsessive thoughts, and performing compulsions temporarily reduces this distress, even though it doesn't solve the underlying problem. For instance, the client washes their hands repeatedly because they fear contamination, and the act of washing provides a brief feeling of relief from that fear. Remember, compulsions are an attempt to control the anxiety caused by obsessions. Question 4. A nurse is preparing to administer an intramuscular IM injection to an adult client. Which site is generally considered the safest and most common for IM injections in adults? A. Deltoid. B. Ventrogluteal. C. Dorsogluteal. D. Vastus lateralis. Answer: B. Ventrogluteal. This question tests your knowledge of safe intramuscular injection sites. The ventrogluteal site is generally considered the safest and most common choice for adults because it is free from major nerves and blood vessels, and it provides a thick muscle mass for absorption. The dorsogluteal site carries a risk of sciatic nerve injury, and the deltoid is smaller, suitable for smaller volumes. For example, many routine vaccinations and antibiotic injections in adults are given in the ventrogluteal muscle. When choosing an IM site, prioritize safety and adequate muscle mass. Question 5. A nurse is caring for a client with a new colostomy. The client expresses concern about the odor from the stoma. What is the most appropriate nursing response? A. You will get used to the odor over time. B. Let's review ways to manage odor, such as diet and proper pouching. C. Odor is a normal part of having a colostomy. D. Perhaps you should limit your social interactions. Answer. B. Let's review ways to manage odor, such as diet and proper pouching. This question assesses therapeutic communication and practical client education for ostomy care. The client's concern about the odor indicates a need for proactive solutions and reassurance. While some odor is normal, directly stating, "You will get used to it," or "It's normal," can be dismissive. The most appropriate response offers practical solutions and empowers the client to manage their condition. For example, discussing specific foods that cause odor, like broccoli, or ensuring a proper pouch seal can significantly reduce concerns. Always empower clients by providing tangible strategies to manage their symptoms. Question 6. The nurse is teaching a client about self-monitoring blood glucose, SMBG. Which statement by the client indicates an understanding of the teaching? A. I will check my blood sugar only when I feel symptoms. B. I should wash my hands with soap and water before testing. C. I can reuse lancets to save money. D. My doctor will tell me exactly when to check my blood sugar. Answer. B. I should wash my hands with soap and water before testing. This question evaluates a client's understanding of proper technique for self-monitoring blood glucose. The keyword, understanding, requires identifying the correct and safe practice. Washing hands with soap and water before testing removes food residues or other contaminants that could alter the blood glucose reading and helps prevent infection. Reusing lancets increases the risk of infection and dulls the lancet, causing more pain, and checking only when symptomatic misses important trends. For example, if someone eats a sugary snack before testing without washing their hands, the sugar residue on their fingers could falsely elevate the reading. Always emphasize proper hygiene to ensure accurate and safe results. Question 7. A nurse is providing discharge teaching to a client with a new prescription for warfarin, Coumadin. Which dietary instruction is most important for the nurse to include? A. Avoid all fruits and vegetables. B. Consume a consistent intake of vitamin K-rich foods. C. Increase intake of foods high in iron. D. Limit fluid intake to prevent fluid overload. Answer. B. Consume a consistent intake of vitamin K-rich foods. This question tests knowledge about medication education, specifically for warfarin. The keyword, warfarin, should immediately prompt thoughts about its interaction with vitamin K, which plays a crucial role in blood clotting. Warfarin works by interfering with vitamin K-dependent clotting factors, so a consistent intake of vitamin K-rich foods, like green leafy vegetables, is vital to maintain a stable INR, international normalized ratio, and prevent either bleeding or clotting. For example, suddenly eating a large spinach salad after avoiding greens could drastically change the drug's effect. Emphasize consistency in vitamin K intake, not avoidance or increase, to maintain therapeutic levels. Question 8. A client is admitted to the emergency department with sudden onset of severe, crushing chest pain radiating to the left arm. What is the nurse's priority action? A. Obtain a complete history. B. Administer aspirin and nitroglycerin as prescribed. C. Prepare for immediate cardiac catheterization. D. Document the client's vital signs. Answer. B. Administer aspirin and nitroglycerin as prescribed. This question requires prioritization in a cardiac emergency, indicated by the keywords, sudden onset, severe, crushing chest pain, and radiating to the left arm, which are classic signs of a myocardial infarction. While obtaining history and vital signs are important, the immediate priority is to reduce cardiac workload and improve oxygenation to the heart muscle. Administering aspirin and nitroglycerin, if not contraindicated, are critical initial interventions to prevent further myocardial damage and relieve pain. For example, delaying these medications could worsen cardiac ischemia. Always remember that in chest pain emergencies, interventions to preserve heart muscle are paramount. Question 9. The nurse is caring for a client who is receiving total parenteral nutrition, TPN, through a central venous catheter. Which finding indicates a complication related to TPN administration? A. Blood glucose level of 120 mg per deciliter. B. Weight gain of 1 kg in 24 hours. C. Temperature of 101.5 degrees Fahrenheit 38.6 degrees Celsius. D. Urine output of 50 milliliters per hour. Answer: C. Temperature of 101.5 degrees Fahrenheit 38.6 degrees Celsius. This question assesses your ability to identify complications associated with total parenteral nutrition, TPN, via a central line. The keyword, complication, points to an adverse effect. A temperature of 101.5 degrees Fahrenheit 38.6 degrees Celsius is a significant sign of infection, which is a major risk with central venous catheters used for TPN due to the high glucose content of the solution. While a slight weight gain can be normal, 1 kg in 24 hours might indicate fluid overload, and a blood glucose of 120 mg per deciliter is within an acceptable range for TPN clients, as is 50 ml per hour urine output. For instance, a fever in a TPN client often signals a catheter-related bloodstream infection, which requires immediate attention. Always prioritize signs of infection with central lines and TPN. Question 10. A client with a new prescription for lithium carbonate for bipolar disorder asks the nurse, "How long will it take for this medication to start working?" What is the nurse's best response? A. You should feel the effects within a few days. B. It typically takes 1 to 3 weeks to reach therapeutic levels. C. You'll notice an immediate improvement in your mood. D. The medication only works during acute manic episodes. Answer: B. It typically takes 1 to 3 weeks to reach therapeutic levels. This question tests your knowledge of common psychotropic medication onset times, specifically for lithium. The keyword, "How long will it take?" prompts information about the drug's therapeutic window. Lithium does not have an immediate effect. It requires time for the body to build up to a therapeutic level, which typically takes 1 to 3 weeks. It's crucial for client education to manage expectations and encourage adherence. For example, if a client expects immediate relief, they might stop taking the medication too soon. Always educate clients that many psychiatric medications require consistent use over time to achieve full therapeutic benefits. Question 11. The nurse is planning care for a client with generalized anxiety disorder. Which nursing intervention is most appropriate to help reduce the client's anxiety? A. Encourage discussion of past traumatic events. B. Provide uninterrupted periods of rest and sleep. C. Teach relaxation techniques such as deep breathing. D. Limit clients' communication with family and friends. Answer: C. Teach relaxation techniques such as deep breathing. This question focuses on appropriate nursing interventions for anxiety reduction. The keyword, reduce anxiety, guides you to therapeutic strategies. While rest is important, and discussing past trauma might be part of therapy, teaching active coping mechanisms like relaxation techniques gives the client tools to manage their anxiety in the moment. Deep breathing exercises can quickly activate the parasympathetic nervous system, promoting a sense of calm. For instance, a client can use deep breathing during moments of heightened anxiety, like before a stressful appointment. Always empower clients with practical, self-management strategies for anxiety. Question 12. A nurse is conducting a health fair and providing education on fall prevention for older adults. Which statement indicates an understanding of a key strategy for fall prevention? A. I should avoid all physical activity to prevent falls. B. I will wear loose-fitting clothing around the house. C. I need to have my vision checked regularly and wear appropriate eyewear. D. I should keep all lights dim to help me sleep better. Answer: C. I need to have my vision checked regularly and wear appropriate eyewear. This question assesses understanding of practical fall prevention strategies for older adults. The keyword, fall prevention, directs you to actions that reduce risk. Impaired vision is a significant risk factor for falls, as it can lead to misjudging steps, obstacles, or uneven surfaces. Regular vision checks and correctly prescribed eyewear directly address this modifiable risk. Avoiding all activity can lead to deconditioning, loose clothing can trip someone, and dim lighting increases the risk of not seeing hazards. For example, a senior citizen might trip over a rug they didn't see clearly if their vision isn't corrected. Always consider environmental and sensory factors when teaching fall prevention. Question 13. The nurse is assessing a newborn in the nursery. Which finding should be reported to the healthcare provider immediately? A. Acrocyanosis. B. Respiratory rate of 50 breaths/min. C. Jaundice appearing at 12 hours of age. D. Presence of Epstein's pearls. Answer: C. Jaundice appearing at 12 hours of age. This question tests your knowledge of normal versus abnormal findings in a newborn assessment. The keyword, immediately, indicates a potentially urgent issue. Jaundice appearing within the first 24 hours of life, pathological jaundice, is an abnormal finding that needs immediate investigation, as it can indicate serious underlying conditions like hemolytic disease and lead to kernicterus if untreated. Acrocyanosis, bluish discoloration of hands and feet, a respiratory rate of 50, and Epstein's pearls, white cysts on gums, are all considered normal variations in newborns. For instance, early jaundice could mean the baby's red blood cells are breaking down too quickly. Always be vigilant for jaundice that presents early in a newborn's life. Question 14. A nurse is teaching a client about managing chronic pain. Which statement by the client indicates an understanding of effective pain management? A. I should only take my pain medication when the pain is unbearable. B. I will try to push through the pain without medication. C. I can use a combination of medication and non-pharmacological methods. D. I expect my pain to be completely eliminated with medication. Answer: C. I can use a combination of medication and non-pharmacological methods. This question assesses a client's understanding of holistic and effective chronic pain management. The keyword, effective pain management, points to a comprehensive approach. Relying solely on medication when pain is unbearable or avoiding medication altogether are ineffective strategies for chronic pain, which aims for pain reduction and improved function, not complete elimination. A combination of pharmacological, example scheduled medication, and non-pharmacological interventions, example heat/cold, exercise, relaxation, distraction, provides the most comprehensive and effective approach. For example, a client might take their prescribed pain medication and also use a heating pad or practice meditation. Empower clients to use multiple strategies to achieve better pain control and quality of life. Question 15. The nurse is caring for a client with a nasogastric (NG) tube inserted for gastric decompression. Which assessment finding indicates the NG tube is functioning effectively? A. The client reports increased abdominal distension. B. The client's bowel sounds are absent. C. There is continuous suction with minimal drainage. D. The client reports relief of nausea and vomiting. Answer: D. The client reports relief of nausea and vomiting. This question focuses on evaluating the effectiveness of a nasogastric tube for gastric decompression. The keywords, functioning effectively, and gastric decompression, mean the tube is doing its job of removing stomach contents and relieving symptoms. The primary purpose of decompression is to alleviate nausea, vomiting, and abdominal distension caused by accumulation of gastric secretions or gas. If the tube is effectively decompressing the stomach, the client should report relief of these symptoms. For example, if a client had severe bloating and vomiting before the tube, feeling better indicates it's working. Always link the intervention's purpose to the expected client outcome. Question 16. A nurse is providing education to a client with a new diagnosis of type 1 diabetes mellitus. Which statement by the client indicates a need for further teaching? A. I will need to take insulin injections for the rest of my life. B. I can stop taking insulin once my blood sugar is consistently normal. C. I should check my blood sugar levels regularly throughout the day. D. I need to pay attention to the carbohydrates in my meals. Answer: B. I can stop taking insulin once my blood sugar is consistently normal. This question assesses a client's understanding of type 1 diabetes management. The keyword, need for further teaching, indicates an incorrect belief. Type 1 diabetes is an autoimmune condition where the body does not produce insulin, so insulin replacement therapy is lifelong and cannot be stopped, regardless of blood sugar control. The other statements are correct. For example, stopping insulin even when blood sugar is normal will quickly lead to hyperglycemia and ketoacidosis. Always emphasize that type 1 diabetes requires continuous insulin therapy for survival. Question 17. The nurse is reviewing medication orders for a client. Which order would the nurse question? A. Morphine 2 mg for every 4 hours PRN pain level 7 to 10. B. Furosemide 20 mg PO daily. C. Insulin glargine 10 units subcutaneously every morning before breakfast. D. Vancomycin 1 gram for every 12 hours, infuse over 30 minutes. Answer: D. Vancomycin 1 gram for every 12 hours, infuse over 30 minutes. This question tests medication safety and proper administration. The keyword, question, indicates a potential error or unsafe practice. Vancomycin, an antibiotic, is known to cause red man syndrome if infused too rapidly, and it typically requires a slower infusion rate, usually over at least 60 to 90 minutes for 1 gram, not 30 minutes. The other orders are generally within safe parameters. For example, infusing vancomycin too quickly could cause flushing, rash, and hypotension, indicating a histamine reaction. Always check the recommended infusion rates for medications, especially antibiotics like vancomycin, to prevent adverse reactions. Question 18. A nurse is assessing a client who is actively hallucinating. Which intervention is most appropriate for the nurse to implement? A. Reinforce the reality of the hallucination by acknowledging it. B. Engage the client in a lengthy discussion about the content of the hallucination. C. Ask the client to explain how the hallucination makes them feel. D. Distract the client with a concrete, reality-based activity. Answer: D. Distract the client with a concrete, reality-based activity. This question focuses on therapeutic communication and interventions for a client experiencing hallucinations. The keyword, actively hallucinating, means the client is currently perceiving something that isn't real. Reinforcing the hallucination or discussing its content validates it and can worsen the client's distress or psychosis. Asking about feelings related to the hallucination can be therapeutic, but distracting with a reality-based activity is often the most immediate and effective way to shift the client's focus away from the hallucination and back to reality. For example, inviting the client to walk, play a simple game, or listen to music can help redirect their attention. Always prioritize reorienting clients to reality when they are actively hallucinating. Question 19. A nurse is providing care to a client who underwent abdominal surgery 2 days ago. The client reports severe incisional pain, is restless, and states, "I just want to go home." What is the nurse's priority action? A. Administer prescribed pain medication. B. Encourage the client to ambulate to improve comfort. C. Explain the importance of rest for healing. D. Document the client's statement in the chart. Answer: A. Administer prescribed pain medication. This question assesses prioritization of care in a post-surgical client experiencing pain and distress. The keywords severe incisional pain, restless, and I just want to go home indicate that uncontrolled pain is likely contributing to the client's agitation and desire for discharge. Managing pain is a critical nursing priority post-surgery, as it impacts recovery, mobility, and psychological well-being. Administering pain medication addresses the root cause of the distress and facilitates other aspects of recovery, like ambulation and rest. For instance, if the client is in severe pain, they will be unable to ambulate effectively or rest. Always address acute pain promptly as a primary nursing intervention. Question 20. The nurse is caring for a client with a history of alcohol use disorder who is experiencing acute alcohol withdrawal. Which medication is commonly prescribed to manage withdrawal symptoms? A. Opioid analgesics. B. Benzodiazepines. C. Antidepressants. D. Antipsychotics. Answer: B. Benzodiazepines. This question tests your knowledge of pharmacological interventions for acute alcohol withdrawal. The keywords alcohol use disorder and acute alcohol withdrawal are key. Benzodiazepines, such as lorazepam, diazepam, or chlordiazepoxide, are the medications of choice for managing acute alcohol withdrawal symptoms because they reduce central nervous system hyperexcitability, preventing seizures and delirium tremens. Opioids, antidepressants, and antipsychotics are not primary treatments for alcohol withdrawal. For example, administering lorazepam helps calm the client's tremors, anxiety, and prevents more severe complications like seizures. Always remember that benzodiazepines are the cornerstone of safe alcohol withdrawal management. Question 21. A nurse is teaching a group of expectant parents about preventing sudden infant death syndrome, SIDS. Which instruction is most important for the nurse to include? A. Place the infant in a prone position for sleep. B. Ensure the infant sleeps on a soft mattress with blankets. C. Share a bed with the infant to facilitate bonding. D. Place the infant on their back to sleep, every sleep. Answer: D. Place the infant on their back to sleep, every sleep. This question focuses on critical SIDS prevention education. The keyword, most important, highlights the highest impact intervention. The Back to Sleep campaign, now Safe to Sleep, has been highly effective in reducing SIDS rates by advocating that infants be placed on their back for every sleep, whether it's a nap or nighttime sleep. Prone sleeping, soft bedding, and bed sharing increase the risk of SIDS. For example, if a baby is placed on their stomach, they may rebreathe exhaled air, leading to suffocation. Always emphasize the Back to Sleep recommendation as the cornerstone of SIDS prevention. Question 22. A client is receiving intravenous fluids at a rapid rate. The nurse notes crackles in the client's lungs, shortness of breath, and an elevated heart rate. Which complication should the nurse suspect? A. Dehydration. B. Hypokalemia. C. Fluid volume excess. D. Anaphylactic reaction. Answer: C. Fluid volume excess. This question tests your ability to recognize signs of fluid volume imbalance due to intravenous fluid administration. The keywords, rapid rate, crackles in the client's lungs, shortness of breath, and elevated heart rate, are classic signs of fluid volume excess, also known as hypervolemia. These symptoms occur when the circulatory system is overloaded with fluid, leading to pulmonary congestion. Dehydration would present with opposite signs, and the other options are unrelated to these specific symptoms. For example, if a client receives too much fluid too quickly, their lungs can fill with fluid, causing breathing difficulties. Always correlate symptoms like crackles and shortness of breath with fluid overload. Question 23. The nurse is preparing to administer an oral medication to a client. What is the priority nursing action before administering the medication? A. Check the expiration date of the medication. B. Educate the client about the medication's side effects. C. Verify the client's identity using two identifiers. D. Document the medication administration in the chart. Answer: C. Verify the client's identity using two identifiers. This question is about medication administration safety and the rights of medication administration. The keyword priority directs you to the most crucial step for patient safety. Verifying the client's identity using two identifiers, example name and date of birth, is paramount to ensure the right medication is given to the right patient, preventing serious medication errors. While checking expiration, educating, and documenting are vital, confirming patient identity comes first to ensure foundational safety. For instance, administering insulin to the wrong patient could be fatal. Always ensure you have the right patient before proceeding with any medication administration. Question 24. A nurse is caring for a client with a new cast on the right arm. Which assessment finding should be reported to the healthcare provider immediately? A. Swelling distal to the cast. B. Capillary refill of 2 seconds. C. Pink color of the fingers. D. Client reports numbness and tingling in the fingers. Answer: D. Client reports numbness and tingling in the fingers. This question assesses your ability to identify signs of potential neurovascular compromise in a client with a cast. The keywords, new cast, and immediately indicate a need to watch for compartment syndrome or other circulatory/nerve issues. Numbness and tingling, paresthesia, in the fingers distal to the cast are concerning signs of nerve compression or inadequate blood flow, requiring urgent evaluation. Swelling is expected, but numbness and tingling are more critical, while normal capillary refill and pink color are good signs. For example, if the cast is too tight, it can compress nerves and blood vessels, leading to irreversible damage if not addressed quickly. Always monitor for the 5 Ps, pain, pallor, pulselessness, paresthesia, and paralysis when assessing a casted extremity. Question 25. A nurse is providing discharge teaching to a client with chronic obstructive pulmonary disease, COPD. Which instruction is most important to include regarding activity? A. Encourage prolonged periods of rest to conserve energy. B. Advise the client to use a wheelchair for all mobility. C. Teach the client to pace activities and use pursed lip breathing. D. Recommend avoiding all exercise to prevent shortness of breath. Answer: C. Teach the client to pace activities and use pursed lip breathing. This question focuses on activity management for clients with COPD. The keyword, most important, guides you to the intervention that best supports self-management and quality of life. While rest is important, complete avoidance of activity leads to deconditioning. Teaching clients to pace activities means breaking tasks into smaller steps and resting between them, conserving energy. Pursed lip breathing helps expel trapped air and improve gas exchange, reducing dyspnea during exertion. For example, a client with COPD might clean one room, then rest using pursed lip breathing before cleaning another. Always emphasize energy conservation techniques and breathing strategies to help clients with COPD maintain activity tolerance. Question 26. The nurse is caring for a client experiencing a grand mal seizure. What is the nurse's priority intervention during the seizure? A. Restrain the client to prevent injury. B. Place a padded tongue blade in the client's mouth. C. Turn the client to their side. D. Leave the client alone to call for help. Answer: C. Turn the client to their side. This question asks for the priority intervention during a grand mal, tonic-clonic, seizure. The core concept is client safety, especially related to the airway. Turning the client to their side, recovery position, is the priority action to prevent aspiration of vomit or saliva and maintain a patent airway. Attempting to restrain the client can cause injury, and placing anything in the mouth is dangerous due to risk of injury or airway obstruction. Leaving the client alone is unsafe. For example, if a client is on their back during a seizure, they could choke on their secretions. Always protect the airway first and ensure safety without restraint. Question 27. A nurse is preparing a sterile field for a dressing change. Which action by the nurse indicates a break in sterile technique? A. The nurse dons sterile gloves after preparing the sterile field. B. The nurse places sterile items within 1 inch of the edge of the sterile field. C. The nurse turns her back to the sterile field to retrieve additional supplies. D. The nurse keeps hands above waist level when wearing sterile gloves. Answer: C. The nurse turns her back to the sterile field to retrieve additional supplies. This question assesses knowledge of maintaining a sterile field. The keyword, break in sterile technique, identifies an action that contaminates the field. Once a sterile field is set up, the nurse must maintain constant visibility of it. Turning one's back risks unintentional contamination, as items outside the nurse's direct line of sight could be considered non-sterile. Sterile items should be kept within the 1 inch border, sterile gloves donned after the field, and hands kept above the waist. For example, if the nurse turns away, their scrub top might brush the field, or they might unknowingly step on a sterile package. Always face your sterile field and keep it within your line of vision. Question 28. A nurse is teaching a client about modifiable risk factors for coronary artery disease, CAD. Which factor should the nurse emphasize as having the most significant impact? A. Family history of heart disease. B. Age over 60 years. C. Smoking. D. Male gender. Answer: C. Smoking. This question focuses on modifiable risk factors for CAD and their impact. The keywords, modifiable risk factors, and most significant impact, guide you to factors that can be changed and have a strong correlation with CAD. While family history, age, and male gender are non-modifiable risk factors, smoking is a major modifiable risk factor that significantly increases the risk of CAD by damaging blood vessels and promoting atherosclerosis. Quitting smoking has a profound positive effect on cardiac health. For example, a smoker has a much higher chance of developing CAD compared to a non-smoker, even if other risks are present. Always prioritize education on modifiable risk factors, especially smoking cessation, for cardiovascular health. Question 29. The nurse is assessing a child with suspected appendicitis. Which assessment finding is most indicative of appendicitis? A. Rebound tenderness at McBurney's point. B. Generalized abdominal pain. C. Diarrhea for 24 hours. D. Absence of fever. Answer: A. Rebound tenderness at McBurney's point. This question tests your knowledge of the classic signs of appendicitis. The keyword, most indicative, points to the hallmark symptom. Rebound tenderness, especially at McBurney's point, located in the right lower quadrant, about 1/3 of the way from the anterior superior iliac spine to the umbilicus, is a classic and highly indicative sign of appendicitis, suggesting peritoneal irritation. Generalized abdominal pain, diarrhea, or absence of fever are less specific and can be present in other conditions. For instance, pressing down on McBurney's point and then quickly releasing causes sharp pain, indicating inflammation of the appendix. Always recall McBurney's point and rebound tenderness as key signs of appendicitis. Question 30. A client is prescribed a clear liquid diet. Which food item is appropriate for the nurse to offer the client? A. Cream of mushroom soup. B. Orange juice with pulp. C. Plain gelatin. D. Milkshake. Answer: C. Plain gelatin. This question assesses your understanding of diet orders, specifically a clear liquid diet. The term clear liquid means any liquid that you can see through at room temperature and that is easily digested, leaving minimal residue in the digestive tract. Plain gelatin fits this definition as it is transparent and non-irritating. Cream soup, orange juice with pulp, and milkshakes are all opaque and contain solid particles or fats, making them inappropriate for a clear liquid diet. For example, Jell-O, broth, and ginger ale are common clear liquid items. Always remember that clear liquids are truly clear and easily digestible. Question 31. A nurse is caring for a client who is NPO, nothing by mouth, for an upcoming procedure. The client asks for a glass of water. What is the nurse's best response? A. Go ahead, a small sip of water won't hurt. B. I understand you're thirsty, but it's important you don't drink anything. C. I will check with the doctor to see if you can have water. D. You can have ice chips if you chew them slowly. Answer. B. I understand you're thirsty, but it's important you don't drink anything. This question tests therapeutic communication and adherence to NPO status for client safety. The keyword NPO is a strict order meaning nothing by mouth, usually to prevent aspiration during surgery or other procedures. Offering water or ice chips, or checking with the doctor, if the order is clearly NPO, is inappropriate. The best response is empathetic yet firm, explaining the importance of adhering to the NPO order for the client's safety. For instance, if a client drinks water before surgery, they could aspirate it into their lungs during anesthesia. Always prioritize adherence to NPO orders for client safety. Question 32. The nurse is educating a pregnant client about warning signs during the third trimester. Which symptom should the nurse instruct the client to report immediately? A. Braxton Hicks contractions. B. Fetal movement of 10 kicks in 2 hours. C. Swelling in the ankles at the end of the day. D. Vaginal bleeding. Answer. D. Vaginal bleeding. This question focuses on recognizing urgent warning signs in the third trimester of pregnancy. The keyword immediately highlights a symptom that requires urgent medical attention. Vaginal bleeding during the third trimester is a serious warning sign that could indicate placental abruption, placenta previa, or other complications threatening the mother or fetus and always warrants immediate evaluation. Braxton Hicks contractions, adequate fetal movement, kick counts, and mild ankle swelling are generally normal findings in the third trimester. For example, bright red vaginal bleeding could mean the placenta has separated from the uterine wall. Always instruct pregnant clients to report any vaginal bleeding immediately. Question 33. A nurse is caring for a client with a full-thickness wound that requires packing. Which type of dressing material is most appropriate for a wound with significant exudate? A. Transparent film dressing. B. Hydrocolloid dressing. C. Alginate dressing. D. Non-adherent gauze. Answer. C. Alginate dressing. This question assesses your knowledge of wound care dressings. The keywords full-thickness wound, packing, and significant exudate are crucial clues. Alginate dressings are highly absorbent, made from seaweed, and are excellent for wounds with significant exudate because they form a gel-like substance as they absorb fluid, promoting a moist wound environment. Transparent films and hydrocolloids are better for wounds with minimal to moderate exudate or for protection, and non-adherent gauze may not absorb enough. For example, an alginate dressing can absorb heavy drainage from a pressure ulcer, preventing maceration of surrounding skin. Always choose a dressing that matches the wound's specific needs, especially for exudate management. Question 34. The nurse is conducting a home safety assessment for an older adult client. Which finding indicates a need for immediate intervention to prevent falls? A. Area rugs secured with non-slip pads. B. Grab bars installed in the bathroom. C. Dim lighting in hallways. D. Clear pathways free of clutter. Answer: C. Dim lighting in hallways. This question focuses on identifying environmental hazards that contribute to falls in older adults. The keyword, immediate intervention, directs you to the most dangerous finding. Dim lighting in hallways significantly increases the risk of falls because it impairs visibility, making it difficult for an older adult to see obstacles, steps, or uneven surfaces. The other options are positive safety measures that help prevent falls. For example, an older adult might trip over an unseen object or misstep on stairs if the hallway is poorly lit. Always prioritize adequate lighting in all areas, especially pathways, for fall prevention. Question 35. A nurse is providing care to a client receiving chemotherapy who reports severe nausea and vomiting. Which intervention is most appropriate? A. Administer antiemetic medication proactively before chemotherapy. B. Offer large, high-fat meals to promote appetite. C. Encourage vigorous exercise immediately after chemotherapy. D. Advise the client to lie flat for several hours after eating. Answer: A. Administer antiemetic medication proactively before chemotherapy. This question focuses on managing chemotherapy-induced nausea and vomiting, CNV. The keyword, most appropriate, emphasizes proactive and effective strategies. Administering antiemetic medication proactively, before chemotherapy infusion, is the most effective approach to prevent or significantly reduce CNV, rather than waiting for severe symptoms to develop. Large, high-fat meals, vigorous exercise, and lying flat are likely to worsen nausea. For example, if a client takes their antiemetic 30 minutes before their chemotherapy, they are much less likely to experience severe nausea during and after the infusion. Always remember that preventing nausea is more effective than treating it once it's severe. Question 36. The nurse is assessing a child with asthma during an exacerbation. Which finding indicates worsening respiratory status and requires immediate action? A. Respiratory rate of 28 breaths/min. B. Mild wheezing on expiration. C. Use of accessory muscles and nasal flaring. D. Oxygen saturation of 95% on room air. Answer: C. Use of accessory muscles and nasal flaring. This question assesses the ability to identify signs of respiratory distress in a child with asthma. The keywords, worsening respiratory status, and immediate action, highlight critical signs of increased work of breathing. The use of accessory muscles, like those in the neck and chest, and nasal flaring indicate significant respiratory effort and impending respiratory failure in a child with asthma exacerbation. While a respiratory rate of 28 or mild wheezing can be present, these signs are more concerning. For example, a child using their neck muscles to breathe is struggling more than one just having mild wheezing. Always recognize the use of accessory muscles as a sign of severe respiratory distress in children. Question 37. A nurse is caring for a client with a history of recurrent urinary tract infections, UTIs. Which teaching point is most important for preventing future UTIs? A. Limit fluid intake to reduce bladder fullness. B. Wipe from back to front after toileting. C. Avoid urinating frequently to allow the bladder to fully empty. D. Urinate before and after sexual intercourse. Answer: D. Urinate before and after sexual intercourse. This question focuses on essential education for preventing recurrent UTIs. The keyword, most important, guides you to the highest impact preventative measure related to common causes. Urinating before and after sexual intercourse helps flush out bacteria that may have entered the urethra during activity, significantly reducing the risk of ascending infection. Limiting fluids, wiping from back to front, or avoiding frequent urination are incorrect or harmful practices. For example, if bacteria enter the urethra during intercourse, urinating afterward helps wash them out before they can ascend to the bladder. Always emphasize proper hygiene and voiding patterns to prevent UTIs. Question 38. The nurse is discussing advanced directives with a client who is competent. Which statement by the client indicates a clear understanding of advanced directives? A. Advanced directives are only for people who are terminally ill. B. My family can make all healthcare decisions for me if I don't have an advanced directive. C. Advanced directives allow me to make decisions about my medical care in the future. D. Once I sign an advanced directive, I can never change it. Answer: C. Advanced directives allow me to make decisions about my medical care in the future. This question tests your understanding of the purpose of advanced directives. The keyword, clear understanding, requires identifying the correct definition. Advanced directives, such as a living will or durable power of attorney for healthcare, are legal documents that allow competent individuals to make decisions about their future medical care, especially if they become unable to communicate their wishes. They are not just for the terminally ill. Family cannot automatically make all decisions without one, and they can be changed or revoked at any time. For example, an advanced directive might specify that a client does not want artificial ventilation if they are in a persistent vegetative state. Always empower clients to make their future healthcare wishes known through advanced directives. Question 39. A nurse is assessing a client's pain level using a numeric rating scale, 0 to 10. The client states their pain is an 8. What is the nurse's next immediate action? A. Document the pain score in the chart. B. Ask the client to describe the quality of the pain. C. Administer prescribed pain medication. D. Reassess the pain in 30 minutes. Answer: C. Administer prescribed pain medication. This question assesses the immediate priority in pain management. The keyword, immediate action, and the client's report of pain is an 8, which is severe pain, indicate that relief is urgently needed. While documenting and assessing pain characteristics are important, the priority is to provide relief by administering prescribed pain medication. Delaying medication for severe pain is inappropriate. For example, if a client reports an 8/10 pain level, the immediate goal is to reduce that pain using available interventions. Always prioritize providing comfort and relief for severe pain as soon as possible. Question 40. The nurse is caring for a client who is postoperative from a hip replacement. Which intervention is most important to prevent deep vein thrombosis, DVT? A. Encourage coughing and deep breathing every 2 hours. B. Administer prophylactic antibiotics as prescribed. C. Assist the client with early and frequent ambulation. D. Maintain the client in a supine position to promote rest. Answer: C. Assist the client with early and frequent ambulation. This question focuses on DVT prevention following hip surgery. The keyword, most important, guides you to the most effective intervention. Early and frequent ambulation is a critical non-pharmacological intervention to prevent DVT formation because it promotes venous return and prevents blood pooling in the lower extremities. While coughing/deep breathing prevents respiratory complications, antibiotics prevent infection, and prolonged supine position increases DVT risk, ambulation directly addresses the circulatory stasis. For example, even short walks around the room can significantly reduce DVT risk compared to prolonged bed rest. Always prioritize mobility to prevent DVT in postoperative clients. Question 41. A nurse is providing education to a new mother about breastfeeding. Which statement by the mother indicates effective breastfeeding? A. My baby nurses for only 5 minutes on each breast. B. My baby's cheeks are dimpling while nursing. C. I hear my baby swallowing during feeds. D. My baby falls asleep immediately at the breast. Answer: C. I hear my baby swallowing during feeds. This question assesses understanding of effective breastfeeding cues. The keyword, effective breastfeeding, indicates a need to identify signs of successful milk transfer. Hearing the baby swallowing, a soft "ka" sound, indicates that the baby is actively receiving and ingesting milk, which is a key sign of effective feeding. Nursing for only 5 minutes, dimpling cheeks, which can indicate inefficient latch, or immediately falling asleep, which can mean not getting enough milk, are not ideal signs. For example, active swallowing indicates the baby is getting full feeds and not just comfort sucking. Always listen for audible swallowing to confirm effective milk transfer during breastfeeding. Question 42. The nurse is assessing a client who has returned from a colonoscopy. Which assessment finding requires immediate nursing action? A. Client reports mild abdominal cramping. B. Small amount of blood-tinged mucus from the rectum. C. Temperature of 100.8 degrees Fahrenheit 38.2 degrees Celsius and abdominal rigidity. D. Client states they are hungry. Answer: C. Temperature of 100.8 degrees Fahrenheit 38.2 degrees Celsius and abdominal rigidity. This question assesses your ability to identify post-procedural complications, specifically after a colonoscopy. The keywords, immediate nursing action, temperature of 100.8 degrees Fahrenheit 38.2 degrees Celsius, and abdominal rigidity, are critical signs of a potential bowel perforation, a severe complication of colonoscopy. While mild cramping and some blood-tinged mucus can be normal, fever and rigidity are red flags for peritonitis and require urgent medical intervention. Feeling hungry is a normal sensation post-procedure. For example, if the colon was perforated during the procedure, bacteria could leak into the abdominal cavity, causing infection and inflammation. Always prioritize assessment for signs of perforation or bleeding after invasive gastrointestinal procedures. Question 43. A nurse is reviewing the medication list for an elderly client. Which principle should the nurse prioritize when considering medication safety for this population? A. Polypharmacy is always avoidable. B. Older adults metabolize drugs faster. C. Start low, go slow with new medications. D. Adverse drug reactions are rare in older adults. Answer: C. Start low, go slow with new medications. This question focuses on medication safety principles for older adults. The keyword, prioritize, indicates the most important principle for this vulnerable population. Due to age-related physiological changes, example decreased liver and kidney function, altered body fat/water distribution, older adults are more susceptible to adverse drug reactions and toxicity. Therefore, the principle of start low, go slow, administering lower initial doses and titrating slowly, is crucial to minimize risks. Polypharmacy is often unavoidable but needs careful management, metabolism is generally slower, and adverse reactions are more common. For example, giving a standard adult dose of a new sedative to an older adult could lead to excessive drowsiness and falls. Always remember that older adults often require lower doses and slower titration of medications. Question 44. The nurse is assessing a client admitted with a urinary tract infection, UTI. Which finding is an expected symptom of a UTI? A. Polyuria. B. Dysuria. C. Oliguria. D. Anuria. Answer: B. Dysuria. This question tests your knowledge of common symptoms of a urinary tract infection. The keyword, expected symptom, points to a classic manifestation. Dysuria, which means painful or difficult urination, is a hallmark symptom of a UTI due to inflammation and irritation of the bladder and urethra caused by the infection. Polyuria, excessive urination, or oliguria/anuria, decreased/no urination, are not typical primary symptoms of a standard UTI. For example, a client with a UTI often describes a burning sensation when they urinate. Always associate dysuria with urinary tract infections. Question 45. A nurse is providing care to a client who refuses to take their prescribed medication. What is the nurse's first action? A. Document the refusal in the client's chart. B. Educate the client about the consequences of refusal. C. Ask the client for their reason for refusing the medication. D. Notify the healthcare provider immediately. Answer: C. Ask the client for their reason for refusing the medication. This question assesses the appropriate initial response when a client refuses medication. The keyword, first action, indicates the immediate step. Before taking any other steps, the nurse must first understand why the client is refusing. The reason might be fear of side effects, misunderstanding the purpose, discomfort, or a belief that the medication is unnecessary. Understanding the reason guides subsequent interventions, such as providing further education, offering comfort measures, or notifying the provider. For example, if a client refuses pain medication because they fear addiction, the nurse can then provide education to address that specific concern. Always ask why first to understand the client's perspective and guide your next steps. Question 46. The nurse is preparing to administer an iron supplement to a pediatric client. Which instruction should the nurse provide to the parent to enhance absorption and minimize side effects? A. Administer with milk. B. Administer with orange juice. C. Administer before bedtime. D. Administer with a large meal. Answer: B. Administer with orange juice. This question tests your knowledge of medication administration, specifically for iron supplements in children. The keyword, enhance absorption, is crucial. Vitamin C, found in orange juice, significantly enhances the absorption of iron. Administering iron with milk or a large meal can decrease absorption, and bedtime administration does not specifically enhance absorption. For example, taking iron with a glass of orange juice helps the body absorb more of the iron, making the supplement more effective. Always pair iron supplements with a source of vitamin C for optimal absorption. Question 47. A client with chronic kidney disease, CKD, is experiencing pruritus, itching. Which nursing intervention is most appropriate to help alleviate this symptom? A. Encourage hot showers. B. Apply alcohol-based lotions. C. Provide frequent skin care with mild soaps and moisturizers. D. Advise using harsh scrubbing during bathing. Answer: C. Provide frequent skin care with mild soaps and moisturizers. This question focuses on managing pruritus associated with chronic kidney disease. The keyword, most appropriate, guides you to a safe and effective intervention. Pruritus in CKD is often due to accumulation of uremic toxins. Providing frequent skin care with mild, non-drying soaps and liberal application of emollients or moisturizers helps hydrate the skin and reduce itching without causing further irritation. Hot showers, alcohol-based lotions, and harsh scrubbing would further dry and irritate the skin, worsening the itching. For example, using an oatmeal bath or applying a bland lotion can soothe the skin and provide relief. Always prioritize gentle, moisturizing skin care for clients with CKD-related pruritus. Question 48. A nurse is caring for a client who is exhibiting signs of impending death. Which intervention is most appropriate to include in the client's plan of care? A. Encourage aggressive life-sustaining treatments. B. Focus on providing comfort and pain management. C. Limit family visitation to maintain client rest. D. Initiate full code status regardless of client wishes. Answer: B. Focus on providing comfort and pain management. This question addresses end-of-life care for a client who is dying. The concept is palliative care and honoring client wishes. The keyword, impending death, indicates the focus shifts from curative treatment to comfort. The most appropriate intervention is to prioritize comfort, pain management, and dignity, often referred to as palliative care. Aggressive life-sustaining treatments, limiting family, or initiating code status against wishes are generally inappropriate. For example, ensuring the client is free from pain, has their mouth moistened, and is kept clean and dry contributes significantly to their comfort in their final hours. Always prioritize comfort, dignity, and client/family wishes during end-of-life care. Question 49. The nurse is teaching a client about a prescribed low-sodium diet. Which food choice indicates a need for further teaching? A. Fresh fruits and vegetables. B. Canned soup. C. Baked chicken. D. Unsalted nuts. Answer: B. Canned soup. This question tests a client's understanding of a low-sodium diet. The keyword, need for further teaching, indicates an incorrect food choice. Canned soups are typically very high in sodium, used as a preservative and flavor enhancer, making them inappropriate for a low-sodium diet. Fresh fruits, vegetables, baked chicken, without added salt, and unsalted nuts are generally low in sodium. For example, a single serving of canned chicken noodle soup can contain half or more of the recommended daily sodium limit for a low-sodium diet. Always educate clients to read food labels carefully and avoid highly processed foods, especially canned goods, when on a low-sodium diet. Question 50. A nurse is responding to a client's call light and finds the client on the floor next to the bed. What is the nurse's first action? A. Call for assistance. B. Document the incident. C. Assess the client for injuries. D. Move the client back to bed. Answer: C. Assess the client for injuries. This question addresses the immediate priority following a client fall. The keyword, first action, points to client safety. The absolute priority after finding a client on the floor is to assess them for any injuries before attempting to move them. Moving an injured client without assessment could worsen fractures or other trauma. Calling for assistance is important, but assessing the client for injuries must precede any movement or extensive documentation. For example, if a client has a fractured hip, moving them without stabilization could cause further damage. Always prioritize assessing the client's condition and ensuring their safety before any other actions after a fall.